Hi, my name is Dr. Ilya Skolnikov. I'm a diplomate of the International Board of Applied Kinesiology, and I'm the clinic director of Triad of Health Weight Loss Clinic. We have Yvette here today.
I am.
And we're going to be going over the 7 secret, powerful causes of weight loss that your healthcare provider doesn't want you to know about. Because what happens if your healthcare provider knows about these things, or at least if you find out about them and you're able to utilize and apply these 7 secret causes of weight loss in your life, not only will you lose the weight, but you'll also keep the weight that you lose off. And in our office, the average patient who's overweight and wanting to lose some weight loses 10 pounds of weight during their very first week under care. Not 6 months, not 1 month, not 6 weeks, not 3 weeks. 1 week under care, the average patient is losing 10 pounds of weight. So we're pretty much the leaders in weight loss here in Northern California especially. So Yvette, have you ever had challenges with your weight?
I did. Everything started when I was diagnosed with depression, and I was taking those medications, very strong medications, that gave me sugar cravings. So I started to gain a lot of weight. That was very frustrating because that increased my problem, of the depression problem, and the doctors they looks like they don't care my weight problem. We're just focused on the prescription medication.
Doesn't sound so good. Okay, sorry to hear about what you've been through. Well, let's kind of demonstrate the 7 secret causes of weight loss here and their solutions. We might need to break this up into 2 or 3 videos because we only have a limited amount of time, and you probably have a lot of things you're doing as well. Okay, is there any way you can unzip that a little bit just because the metal can interfere with what we're doing? Sorry. Okay, great. So the first thing we're going to check is called ileocecal valve. It has to do with digestion. And a healthy weight requires healthy digestion. So I'm taking a fist and I'm putting the fist here, and then we're pulling down on the arm and we're seeing if the muscle's strong or weak. It's kind of like we're checking circuits in the body. Just like a circuit can cause a light to go on or off, it doesn't mean that the electricity coming to the building is not coming to the building, or that there's a problem with the light bulb. It means that there's a circuit that's going off or that's not working properly. Okay, so there's different circuits in the body. So again, this first one is called the ileocecal valve. It's at the end of the small intestine where the large intestine begins. Very important for proper weight. Okay, and then the next one's called valves of Houston, and that one's at the very end of the large intestine where the anus begins. The next one is called blood sugar. I'm going to take 3 fingers and put them here in the middle of the clavicle. Sorry, that's not so good of a video methodology, but anyway, and then we'll check that point for blood sugar. That one seems okay. The next one, we're going to pull some hair and pull it down a little bit, checking for protein utilization. We're just going to pull some hair like that, and we'll check protein utilization. So we'll pull a little bit of hair here. Then we'll pull down on the arm. The arm seems okay. So that circuit's also working properly. We'll check another one while she's seated here. This is called rib torque. Okay, so we twist here to the right, or left actually, then we twist to the right, and the muscle stays strong. So Yvette does not have that circuit out either. That one's called rib torque. There's another one, actually there's one more that we can check while she's in this position. And this one's called dehydration, or it's a water circuit. Okay, so I'm going to have her put 3 fingers on her tongue, and then I'm going to pull down on her arm and see if the arm is strong or if the arm is weak. Now, it seems okay. These tests may seem sort of, what's the word for it? Overly simple. They may seem a little bit hokey. Hokey's not the most positive word, sort of like a little bit like voodoo magic type thing, or you know, you could use a different way to describe it. And that's fine. That's perfectly acceptable and reasonable that one might observe it to be that way. But it just so happens that I'm a diplomate of the International Board of Applied Kinesiology. I've been studying muscle testing for, I would say now, it's been about 13 or 14 years or so. So I've reached the highest level of training one can achieve as a person who does muscle testing. Again, I've been to over 5 years of graduate school and an additional 4 or 5 years of postgraduate education just to learn how to do a variety of different clinical things with the body. So for example, I'm integrating a lot of other things like laboratory analysis and pulse point analysis and gait analysis and analysis of biomechanics and a variety of other functional medicine type examination things to determine what's happening with each of my patients. Okay. So we're not just doing these simple things, but the power behind what I'm showing you is that these tests are very simple, they're inexpensive, they're relatively quick, and it's ironic and really sort of hilarious because most people just aren't interested, which is one of the reasons we have to make this video to help you understand about it. And they're not interested because there's so much confusion in our society. I mean, just look at what's happening with the government. And so all of this confusion leads to people wanting something that takes a long time, it's relatively ineffective, very expensive, and produces not such great results. Our results are second to nothing. Ours are the most amazing results that anyone has ever gotten in healthcare, period. Okay, let's keep going. So the other thing we can do is we can check the last thing, which we haven't checked yet when it comes to weight, which is cardiac low back. So we'll have you go ahead and lie on your back, you bet, and I'm gonna be putting my hand here on her sternum, and then we're gonna have her push her legs up into my hand, and this is something called cardiac low back. Cardiac low back comes from total body modification. Total body modification is a technique that was developed by Dr. Viktor Frank. Dr. Viktor Frank passed away about 7 years ago, give or take. And so, anyway, now the technique is run by a fellow named Kevin Millay and his family, and this is now being run out of Utah. Total body modification is now run out of Utah. But at any rate, go ahead and kick your legs, push your legs straight up into my hand, breathing. Okay. So that circuit does seem to be out actually. So again, the heart and proper weight are intimately related. If a person's really, really overweight, for every extra pound of fat in the body that a person has, they have to develop an extra mile of arteries and veins to be able to supply that extra pound of fat with nutrition and with proper circulation. So again, I hope this has been really, really helpful. Thank you so much, and we're excited about helping you lose an average of 10 pounds like we have so many hundreds of other people before you. Thank you so much. My name is Dr. Ilya Skolnikov, and this has been Yvette.